Regenerative medicine might be the game changer that you've been waiting for. As the population ages, chronic joint problems and sports injuries are more common. PRP lets you sidestep that insurance bureaucracy. And you set the price, you collect the payment immediately, and you get to focus on care instead of paperwork. Are you thinking about walking away from orthopedics? Hold up for just a minute. Regenerative medicine might be the game changer that you've been waiting for. It's how you take back control, ditch the insurance chaos, and fall in love with medicine again. I'm Dr. Ariana DeMers, the Queen of Business Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. We're kicking off with the big picture. Why regenerative medicine is exploding right now. The orthobiologics market is already massive. You'll see what PRP really is, how it supercharges healing, and why it's winning over patients and doctors. You'll see PRP not just as a treatment, but as a way to reignite your purpose in medicine. So why is the orthobiologics market growing so rapidly? The market for orthobiologic therapies is skyrocketing, and according to industry reports, the global orthobiologic market is about $6.8 billion. And that was in 2024. It's projected to double by 2035.
Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my orthobiologics masterclass, come join us.
So what's driving all this growth? Well, as the population ages, chronic joint problems and sports injuries are more common. Patients are increasingly seeking less invasive treatments that harness the body's own healing potential. In fact, regenerative therapies like PRP or stem cell therapies are the cutting edge in orthopedics right now. And they use your own patient's tissues to accelerate healing, moving away from one-size-fits-all treatments or surgeries towards a more personalized medicine approach. Patients are more aware of these options and requesting them over and over again. And research is fueling new products and new studies every day. So the question is how does PRP work? That's a great question. Platelet-rich plasma is one of the simplest and most popular orthobiologic treatments. In essence, PRP is from your patient's own blood, right? A small blood draw spun down in the centrifuge and concentrated the platelets, which hold growth factors, and then re-injected back into the injured tissue. Obviously, these platelets release growth factors and proteins that decrease inflammation and kickstart tissue repair. Specialists at top hospitals talk about the fact that PRP can improve pain and function in tendons, ligaments, cartilage, and bone injuries. And it's being used for osteoarthritis, tendonitis like tennis elbow, ligament sprains like partial MCL tears, meniscus tears, and a whole lot more. And because it's autologous, PRP is massively safe. In many cases, it helps patients avoid surgery altogether. And yes, I know that sounds crazy coming from a surgeon, but it's what patients are looking for. So the question is, why should you consider adding PRP to your practice? Think about the problems facing orthopods today. Endless paperwork, denials, plummeting reimbursement. Studies show that the administrative tasks, all those prior authorizations, coding, documentation, and poor pay are among the top contributors to orthopedic surgeon burnout. PRP offers a way out of that trap. Because PRP injections are not covered by insurance, this means patients pay cash out of pocket. What that means for you is no prior authorizations, No coding games, no waiting for reimbursement. You simply treat the patient, collect the payment before the treatment is done. So you can own the transaction and you can set a fair price. So think of it this way. Instead of resenting all the time that you spend chasing down the insurance, getting the prioritization, waiting for replies, waiting for approvals, you can spend that time doing something rewarding, helping patients actually get better. In my experience, doctors who added PRP to their practice often feel like they're getting a chance at a second act. For example, Dr. John, he's a composite of many surgeons I work with, was fed up with the paperwork. And he just started offering PRP 2 half days a week. His workflow was super simple. A consult, a blood draw, spin it down, re-inject it. And his patients loved it. He saw significantly fewer cases, but he enjoyed every one because there was no pushback from insurers. And what he told me was he finally loves coming to work again. He says, I actually get to relate to my patients. I don't have to worry about time on the clock. And many orthopedists say the same thing, that PRP rekindles that sense of making a difference for their patients. Regenerative medicine and orthobiologics is a booming field, worth about $6.8 billion globally, and growing between 5 and 7% annually. PRP is a simple in-office treatment using the patient's own blood to promote healing. And it's used for all sorts of musculoskeletal issues, including arthritis, tendon and ligament injuries, and it may even help some of your patients avoid surgery altogether. As a cash pay treatment, PRP lets you sidestep that insurance bureaucracy. And you set the price, you collect the payment immediately, and you get to focus on care instead of paperwork. So, freedom from burnout. By bypassing the insurance companies and the low reimbursements, removes that major cause of stress, gives you back control, and massively enhances your satisfaction in your work. So if this resonates with you, please subscribe and join our community of doctors pursuing a better way. I would also invite you to book a consultation with me, and we can discuss how PRP could fit into your practice. Make sure to subscribe.